Good morning. It is my delight to welcome you here for this exciting day that's been so well planned. I know that I'm excited to hear all of the amazing insights that will be shared with us today. My name is Mildred Thompson, and I'm the co-chair of the Institute of Medicine's Roundtable on the promotion of health equity and the elimination of health disparities. We're very grateful to share this opportunity with the Population Health Roundtable. You're going to be hearing more about them and from them pretty soon. I just want everyone to know that this meeting is being recorded and also webcast, and I welcome those of you who are also joining us via the web. Our roundtable on the promotion of health equity and elimination of health disparities has been developed to really create good dialogue and discussion and to stimulate critical thinking about the role of equity in our issues in trying to address our nation's complex health disparities and health inequities problems. We are very grateful to have a sponsorship of foundations and organizations and government agencies to assist us in doing this work, and we deeply thank them. We really want to make sure that we always celebrate those who are at the table with us trying to figure out the answers to some of these complex solutions, and we include you among those. We really want to make sure that we foster dialogue between all of us today, and I encourage us to raise the tough questions and to not be timid about pushing back on ideas or thinking of new ways of thinking. We have to be comfortable in being able to challenge ourselves and each other to make sure that we're really on the path that's going to create the kind of change that we know we should be a part of. I'm particularly excited about this conversation on movement buildings. And as I started to think back on this, and I realized, you could probably tell from the whiteness of my hair that I've been through a few movements over the course of my life. The most significant one, of course, was the Civil Rights Movement, and I happened to be a part of that. I happened to have been living in the Deep South in Tampa, Florida during the heavy segregation days. So I wasn't one who read about it. I was the one who lived it. I was the one who didn't have a choice in which school I went to or where I worshiped or who my friends were, because there were barriers that really prevented that from happening. And what is really unfortunate is that these were based on our country's policies. And so now we've got a lot to do to change a lot of that. So while that was the most significant one, there were also others and movements that I was a part of. One of the ones that was still ringing in my head now was, please, please don't be a litter bug. Remember that? You know? And so these things stay in your head. And so the idea that you could throw something out the window of a car is just so totally unacceptable. It's a foreign concept. Those of us who remember being in meetings, you know, and then there were ashtrays at the tables, and people would just be smoking. Or being on the airplane and you're in the non-smoking section, but you're still smelling the smoke from where you're sitting. Those things, you can't even imagine them happening today. But a more interesting story I'd like to share with you was just not too long ago, I was in my car, and for some reason, my seatbelt was stuck. And I could not get my seatbelt to move and to close me in. And I had a deadline that I had to go someplace, and I was so horrified that I had to drive without a seatbelt on. I felt so totally insecure. And I remember telling you about having raised in Tampa, Florida. One of my favorite uncles lived in Clearwater. For those of you who know, that's part of the Bay, Tampa, St. Pete, Clearwater. And he used to come and bring us, and we would love to ride in the back of his truck. There were no seat belts back there. We had a delightful time. Everybody wanted to clamor on who can sit in the back of the truck on that long drive between Tampa and Clearwater. My father, who would pile us all in the car, I'm part of a big family, 6 kids in one car. I don't know how that car fit all of us. And we would drive from Tampa to New York. Had a great time. So, and I looked back and I said, how could I now be so worried about driving 1 mile without being in my seatbelt because it's in ingrained in me that it's really violating a major sacrilegious kind of thing. So it shows how movements, and it was a movement about buckling up, it was a movement about litter, it was a movement about drunk driving, it was a movement about anti-smoking. And those are just examples of movements that I've been a part of, and I'm sure that you can probably think of other movements. But it shows the power of a movement. It's not just an individual or an organization making an appeal. It is about stimulating the need for us as a population, as a society, to make a change where we all benefit. So that is why I welcome you today, to have this conversation about what are we going to do? What have we learned from these movements? And what do we need to do to move our work forward so it's not viewed as an insulated moment in history, but that it can be a part of a continuum that people years from now will reflect on, gee, did we really do things that way? I'm so happy that we're on this other side of it, so I welcome that. And so with that, I'm now going to bring up my colleague David to talk about the Population Health Roundtable. Thank you, and again, welcome.